Good morning. Thank you for joining me again today. And I will start the way that I always start. The world has changed. Unfortunately, we have reached more milestones in terms of the number of infections, as well as, unfortunately, the number of deaths. I'm Dr. Geoffrey, the crisis and split-second decisions expert. And today we're covering COVID, the COVID crisis, and how to vote safely. Again, the COVID crisis and how to vote safely. Question is if you have to go and vote in person, what are the three types of people that you want to make sure you avoid? Before we get started, let me just say this. For those of you who are listening later, please press replay. But otherwise, you only have to listen to the greatest content will be in the first 10 minutes of this. Now, ideally, we want to not to have to go and vote live. We want to mail in your vote under ideal circumstances. But just in case, we've got to be prepared to go and vote live if that's what happens. If that's what ends up needing to happen, we must be ready to go and vote live. Not sure why that keeps coming up. Now, there are those group of people who they're going to go vote no matter what. They're going to go vote no matter what, no matter mask, no mask, they're going to go vote. And then we have those group of people who, while they don't want to have to go in, they could be feared into not going to go vote. They can be feared. And if you fall into that category that I'm in, which is haven't figured out who I'm going to vote for. I'm just joking, but we have to admit, at this stage of the game, it's interesting to hear people say they're not sure how they're going to vote for. But the point is, no matter what, go vote. No matter what, go vote. So in summary, this is about going to go vote safely. This is part 2 and 3. I understand something happened with the audio on part 2. Let me summarize part 1. There are 2 determinants of if you get infected with COVID. It's not a one-to-one transmission, meaning that if this pen is Sally and I have COVID and I breathe on Sally, it's not guaranteed Sally is going to get it. 2 main determining factors: the concentration of the virus, as well as your length of exposure. In part 1, we dealt with the concentration. The greatest way to decrease the concentration you are exposed to as it relates to the virus is to wear a mask. Wear a mask. If you have some of those cheap masks, it's probably best to wear a double mask. Oh, I forgot to tell you, I'm a board-certified emergency medicine physician who is practicing on the front lines, and I practice what I preach, meaning that I go into a patient's room knowing that they are COVID positive. There are millions of healthcare providers across the world who go in patients' room knowing that they're COVID positive, and they don't contract COVID. Why? Because they're wearing the necessary gear. Masks are one of them. It decreases the concentration. In part 2, what we talked about is, the second determination of if you can contract COVID is length of exposure, meaning how long you are exposed to the virus. And in part 2, we talked about minimizing the amount of time that you could possibly be exposed to the virus. In other words, if you have to go and vote live, if there's a corridor that you have to wait in, stand outside of the corridor. Why? Because that corridor may not be ventilated. So that decreases the length of exposure in case there's active virus in that area. Number 2, what we talked about is carrying a personal fan. You can purchase it on Amazon, battery driven, a personal fan. Some of them go around your shoulder. Some of them you can hold in the air, but it decreases the concentration and it decreases the length of exposure as well. Again, it decreases the length of exposure. And what we also talked about in the part 2 video was be careful who you decide to drive to the polling places with. There's this myth, and it's across all socioeconomic levels, all the racial barriers, because we see it playing out. There's this myth that if a person's a family member or you know the person, they're less likely to give you COVID. That's not true. That's not true. In fact, the third leading cause of transmissions are family gatherings. Family gatherings. What is my point? Be careful who you ride to the polling place with or to go vote with. Meaning that if it's someone who lives within your house, who lives in your household, no problem. But someone outside your household, all of a sudden you're in a car, a closed environment where therefore there's a greater concentration and your length of exposure in case that person's COVID positive. Now you are in that environment that you don't want to be on. Part 3. Who are the people or the types of people you do not want to be around you do not want to be around while you're in the voting line, even if it means going to the end of the voting line, even if it means standing away from them. Who are the types of people that you don't want to be around? Let me just share. The first one by the way, parents, if it's possible, leave your children at home. If there's somebody who can watch them for you, that's ideal. But you don't want to be around voters who have their children there, especially children between the ages of 0 to 5. Why? The newest studies are showing that ages between the 0 to 5, they are extremely infectious if they're COVID positive. They may be 2 to 100 times, have 2 to 100 times the amount of concentration of an adult, the concentration of active virus. So therefore, if you see someone in line and they have their child, that's a person that if you can move a few people back, real talk, then you may want to move a few people back. 2, now watch how I say this. Be careful of young voters. I mean, those between the ages of 15 and say 30. So you're going to have to make some leaps. You're going to have to make some assessments. And I know that 15-year-olds cannot vote, but maybe the parents bring them. But if they are between 15 and 30, watch them. Why? Because that's the greatest group of people that's spreading the virus because they are asymptomatic carriers. Asymptomatic carriers, meaning that they have active virus, but they don't even know it, which means that they can spread it. Okay, which means that they can spread it. So be careful though. So far, be careful of people who are there with their young children. Number 2, be careful of people who are there with their teenagers who are not voting and voters between the ages of 15 and 30. And by the way, just as a side note, voters between the ages of 18 and 30 in that category, they usually don't vote early in the morning. So that's probably the time to go if you have to go in and vote actively. But you want to be careful of that generation. Of that group of people. And then number 3, be careful of unmasked people. Meaning that there's a large population of people who walk around here unmasked, even in areas where it's required. Be careful of unmasked people. Why? It means they've been walking around for a long time unmasked, which means that they could be asymptomatic carriers, which means they could have active virus. I know some of you are thinking, well, I live in areas where it's a required law for them to wear the mask. It probably is, but intuitively, given the heated voting environment, I would say this. I'm not sure how it's going to play out if someone shows up without a mask and wants to vote. You've got to be prepared for them, meaning that if you see them, you want to make sure that you get a few people back. You don't stand next to them. Those are the ones that you don't want to be by. Because 3 high-risk groups of people. People who show up with their children between the ages of 0 to 5. That's a highly infectious group if they are COVID positive. Young people between the ages of 15 to 30. I get it. The 15 to 18-year-olds are not voting. 15 to 17-year-olds. And 3, unmasked people. People who are walking around there unmasked. The reason why all this is so important is because you will hear them start to talk about, hey, the mask may not work. Hey, you got to be careful of these type of people. There's a fear factor. They want to fear people into not voting. And I can just tell you, look at me, look at the healthcare world as a testament. We wear masks, we wear gloves, and we wear masks and we wear gloves, and 99% of healthcare providers don't contract COVID. And then the third thing that we can do that we will deal with later is socially distance. That is key. Socially distance. That is key. This is part 3. Tomorrow will be part 4, or soon will be part 4. I would encourage you to share this. This is Dr. Geoffrey. You can follow me at splitsecondDecisions.com. or on YouTube at Dr. Geoffrey. Thank you very much. We will take a few questions now. Good morning, Dr. Fred, and you and Fossey are listening during. Hey, thank you, Ms. Crawford. Yeah, believe it or not, Dr. Fossey and I, we have emailed back and forth a few times. I felt honored, having nothing to do with voting. Let me just explain why. Because I convinced him. So we're in a crisis, no doubt. And voting will not be a split-second decision, by the way. It goes against my plan, split-second decisions. Why? Because split-second decisions are those decisions that we make when there's a time constraint, L, lack of information, or C, critical consequences. I know it so well because I go around the world teaching executives how to make split-second decisions, and I teach organizations crisis management. So going to go vote will not be a split-second decision. It will be a deliberate decision that you need to do right now. And part of this 4-part series is, in case you've got to go vote live, there's some equipment that you've got to get. But that's a tangent. Dr. Fauci and I have emailed back and forth because if a vaccine comes out, who's going to pitch it? Who's going to tell America, especially Black America, that it's safe? He wasn't saying that I was going to do it, but my point to him was, hey, I don't see a lot of Black doctors on national media consistently. And if we're going to follow Madison Avenue and how we've been doing it for the last 25 years, and by the way, this is not a racial issue. This is a practical point. This is a practical point, meaning that when you wanted to reach a community, any community, you put people who look like them in front of them. All right, that's what we've done. You know, if you want to get Black folks out to vote, you put Black stars, you put Black actors. For the Hispanic community, same thing, so forth and so on. But what I have noticed and what it stands out amongst many people is, as it relates to COVID, even when it was hitting Black populations differently, did you notice that you did not see Black doctors consistently on national media? So then the question is, when it's time for a vaccination, who do you turn to say, hey, this vaccination will work? And let's be honest, the Black community, we have reasons to be concerned. Historically, there have been many experiments. My point is that there are a lot of factors that the community has to think about. Same with elderly. I don't see a lot of older doctors on TV now. Who's going to pitch it and sell it to them? So that's what we've been going back and forth about. Kim Leah, what's going on with you? I will see you shortly, Kim Leah. So Sylvia, what's going on? Vincent Crosser, hey, I'm voting ugly. Yeah, all right. Vincent said he's voting safely. Look, whoever you vote for, and if you're an undecided voter, wink, wink. Whatever you do, vote. I say wink, wink, because anybody who's undecided now, I look at them and say, really? All right, Princess, I haven't heard from you in a long time. Shay Cannon, she's about to have a birthday. Happy birthday, Shay. Jonathan McMillan, what's up, brother? I have not seen you in a while. How's your son? Has he had to go to, was it Texas or Florida? Kim, what's going on? Kim never got that phone call. Shantae Washington, you mentioned personal fans yesterday. I have one that goes around my neck that blows air into my face, but would that blow virus directly to my face? So that's the one that I'm talking about. Well, one you could look at it as it blows air into your face, but the ones I'm talking about, it blows air, you're right, but believe it or not, it keeps virus from making it to your face. So it decreases the concentration and it decreases the viral load. By the way, I forgot, most things that I tell you come from academic peer-reviewed articles, Dr. Fauci, WHO, or a listserv that I'm on with a bunch of doctors. The information about the fan, I've not read that. That's a practical approach, meaning that I've read about the ventilation in areas, especially small areas, they need to be ventilated, the concentration of the virus, having fans in small ventilated areas. So I made a leap, which is if you have a fan, you're pushing air away from you, it decreases the viral load that makes it to you. Does everybody follow me? And it decreases your length of exposure. So the fan thing is a Dr. Geoffrey making leaps. I'm going to have on a fan. My mama's going to have on a fan. Wife's going to have on a fan. Sister's going to have a fan. And you can get them on YouTube. The reason why I don't put a link in there is because I don't want anybody to say I endorse some fan, the fan didn't work, so forth and so on. All right. Oh, and by the way, I get live calls from people. I do appreciate it. Yes, I do live into organizations. I have a few clients where that I consistently live where the employees can ask me questions as it relates to COVID, and we do that regularly. So please reach out. You can go to my website to contact me at splitseconddecisions.com, as well as you can go to info. You can email me at info@splitseconddecisions.com. And let there be no doubt, people, let there be no doubt we are in a crisis, and we will be in this crisis for a moment. And how you manage this crisis will determine how you will be at the end of this. Humongous. There are life impacts, business impacts, personal impacts, but we've got to manage this because this is where we are. And as you see, and I was wrong. Back in March, I said, if we don't handle this. Back in February, I said, if we don't handle this, we could easily get to 200,000 deaths. It looks like by the end of the year, unfortunately, we may be at 400,000 deaths. But you do not have to contract COVID. All right, let me go on here. Hey, so Shantae, hopefully that answered your question. Sylvia Jones, also, are temperatures being checked at the voting polls? And wouldn't it be wise to take your own pen, pencil, and voting? Yes, I was going to deal with that tomorrow. I don't know if they're being, I don't know if temperatures are being checked. Don't know that at all. But we're going to deal with that tomorrow. Take your own pencil and pens. Not only that, take your own disinfectant wipes, take your own gloves. We're going to talk about that tomorrow. But excellent point. I need people like you give me information on the vaccine and when a real-time line that will be available. Hey, so it's funny you would say that. I was reached out to about being on some vaccine panel. It did not play out, but I did hear the National Medical Association is involved. I'll say that. Jonathan, your point is valid. It would be wise to have medical professionals such as yourself in front of the screen to alleviate concerns within our community. When you're out there, make sure you rock HU gear, brother. Oh, I rock the HU. I got my HU gear on right now. In case anybody forget, that's not Howard, that's Hampton. Oh, no doubt. And not only that, I live in Prince George's County. Our county executive is doing a fantastic job here. But they're preparing to put folks out there who look like the community, because you can't wait until the vaccine comes and then put someone out there. Hey, I'm such and such. You should go get the vaccine. No, it doesn't work that way. And Madison Avenue and marketing, they know that. You've got to develop these people. And that's why I would encourage, if there's anything that you can do, reach out to people at these national stations and say, hey, I don't regularly see a black doctor. So when you're ready to sell this to me, and Dr. Fauci, believe it or not, and many others have the same concerns. Hey, Fraylin, where you been? I've not heard from you. Welcome back. I guess welcome back to me. Vincent Crawford, vote blue. Legal. Oh, yes. By the way, nothing I say should be taken as medical advice. It's just medical information. Nothing I say should be taken as medical advice, just medical information. And in part 4, again, that applies to part 4. Because again, let me say this, and please share this with everyone. Voting is not a last-minute decision. It's not a split-second decision. I posted it. I just forgot where, but I posted the voting timelines where you need to go register and so forth and so on in every state. I would encourage you all to make sure that you are registered. And just so you know, and for any funny stuff that happens, there's some equipment we're going to need in case we've got to go vote live. Having extra masks, having the gloves, the hand sanitizer, and the little fan, which, by the way, is again, that's not officially recommended by the CDC. That's Dr. Geoffrey. You've got to get all that stuff ready in case you have to go vote live. And more importantly, our parents. We have to encourage them. Why? Because you're about to see a media onslaught. It's already happened. It's already happened. You're going to see a media onslaught about why you should not go vote live. Did you hear? And I don't really give myself credit, but I'm going to give myself credit. 2 days after I talked about, you're going to hear people talk about the mask is not safe. What happened? They start saying, well, maybe the masks are not safe. It's all part of a grand plan. to get certain groups of people not out to vote. Because there's a group of people, they're going to go vote no matter what. Maskless, coughing, they're going to go vote. But there's another group of people who they can be feared into not voting. So we all have to do our part. We're in this together because the whole goal is to get everybody to vote. Doesn't matter who you're voting for. Doesn't even matter if you're an undecided voter. Wink, wink. Everyone needs to vote. For league exposure, here we go. It was Texas. Unfortunately, he did not have to return. Knock on wood. And I'm well. Thank you for asking. Hope all is well. Yeah. Oh, me and my family are well. They're home, being homeschooled, teenagers. But everybody's well. You all know that was funny. In fact, I should get a bunch of stars for that one because anyone who's homeschooling, no matter what age, you know what I'm saying. I recently read that 2 HBCU presidents joined COVID, Xavier and Dillard. Good. Alicia Turner said, I recently read that 2 HBCU presidents joined COVID-19 vaccine trials, Xavier and Dillard. That's great news. That is great news. Let's be clear. I do think that Black should be part of studies. But that's just not COVID, but any studies. Because our DNA needs to be a part of it. Vincent, Trump said a vaccine will be ready next week. I worked R&D. Is he flat out lying? Well, in full disclosure, I do nothing with the pharmaceutical industry. Don't know anything about it. But I would say that's a in fact, Dr. Fauci, oh, good, I don't have to say it. Dr. Fauci said, no, it won't be. In fact, the other guy who's ahead of the CDC said, no, one will not be ready by then. And I would encourage you all, I'm going to give you this tidbit of information because I don't know where I'm going to be just in terms of what I'm able to say soon. Don't follow if I decided to take the vaccine, that's one level of advice. When you hear me say, hey, I told my mom, my wife, my kids to go ahead and take it, then that's something else. Then that's the serious advice. But just because I say I'm going to take it, there's a measure of okay with that. But when you hear me say, hey, everybody, my family's going to take this, that means I am endorsing it, just to let you know. And you have to do everything I say. I'm just saying. Oh, by the way, nothing I say should be taken as medical advice either. With or without filters. When you say, what are your thoughts about masks with vents in them? I don't recommend the masks with vents. The studies are showing the masks, and those are usually the KN95s with the little vents. They have greater, the virus has greater access. And I definitely recommend masks with filters. No doubt. Definitely recommend the mask with filters. And even if you get an N95, if those of you all who have them, no, it's hard to walk around all day with an N95 on. But if you happen to have an N95, save that for voting day. Save that for voting day. Oh, and by the way, get some umbrellas. Get some umbrellas. If it's raining, and it's going to be raining in some parts of the country, let's get ready to go. It just happens to be raining. So yeah, thank you very much. Carol Lawson, Nashville. As things continue to open up to pre-COVID times, would personal fans keep us safer while we eat at restaurants, even inside or outside? Oh, hey, Carol Lawson, what's going on, Carol? And let me just say this. I think that personal fans, personal fans are very helpful. I do not recommend eating inside. I do not recommend. There's been no study that said that eating inside it's safe. And as you see, the first place when states start to see an increase, the first place that they hit are bars and restaurants. Outside, I eat at restaurants outside. I don't take my personal fan, but I will. In fact, when I go and do my executive training, because I'm back to doing them live, when I go, I bring my own little personal fan, plug it in, and it's blowing. It's blowing towards my audience. I mean, it's keeping the active virus away from me, and I explain this to them. And it's keeping my virus from them. So yes, that's a great question, Carol Lawson. I do appreciate that. Dale Grant, what's going on? Dale in Atlanta, what's going on? Pamela Jones, I keep my vents closed on my mask and stuff. Oh, okay, Pam Jones, that's great. Keep your mask closed instead of open. Good job, Pam. Good job. Love that. But I would encourage you all, reach out to people. These are strange and scary times. There are 200,000 people who are no longer with us who were here at this time last year. And let's just assume that minimum they knew 5 people. That's his minimum. There's 1 million people who are sad and distraught. And I would encourage you all to just reach out to my people. Maintain hope. Why? Because there's look at it this way. For those of you who are really scared, you've made it this far. You haven't gotten the virus. You do not have to get the virus. You do not have to get the virus. And while this is going on, I'm trying to shorten these. Let me say this part again. Herd immunity. We're not seeking herd immunity. In fact, it would be sinful, diabolical, completely wrong for anyone to expect to seek herd immunity without a vaccine. Without that, evil. Here's why. In order for there to be herd immunity, 60 to 70% of the population needs to have antibodies. There's only 2 ways to get antibodies. It's from contracting the virus or from a vaccine. Therefore, trying to get herd immunity without a vaccine means that 60 to 70% of the population, the U.S. population, needs to contract the virus. If you adjust all the numbers and all that, what that means is that will require 3.5 million deaths. 3.5 million deaths. Again, trying to get herd immunity without a vaccine means that 3.5 million deaths. That's why anyone of you here talking about herd immunity without a vaccine, say, I rebuke you. All right, I'm sorry to get off on my tangent. I usually do not do that. Keep my vents closed. All right, yeah, thank you. Any thoughts on the idea that the number of COVID deaths has been inflated? That's a great question. We can prove that's great. So Frey writes, any thoughts on the idea that the number of COVID deaths has been inflated? I think that those thoughts are misleading and politically motivated. Let me tell you why. Even prior to COVID, there's a national database that you can predict. I mean, it's based upon hundreds of years of information. You can predict the number of deaths in a state per year. I'll take it a step further. You can even predict it per 6 months. Take it even further. You can even break it down by the month. I'll take it one further. You can break it down by the week. Let's just say this. In Prince George's County, Maryland, in that county, there's data that already exists that said, okay, on this week in Prince George's County, I'm making up a number. I'm making a number. 5 people should die. 5 people should I die. That's based upon data. Now let's just say all of a sudden 12 people die. Wait a minute. The last 100 years, only 5 people have died. Why is there 12? Why did 12 die? What's my point? We can look at the data based upon the number of people who should have died and the one who actually died. And that data basically shows that we are deflating the number of COVID deaths. Deflating. I answered that question in a roundabout way, but hopefully, Frey, that answered it. To Keisha Ford, are there any more known symptoms of COVID? There are a lot more known symptoms of COVID, and I guess I should do another live on it. But right now, the most important ones as relates to severity are anything respiratory related. Meaning, watch the cough, because that's a common symptom. Cough, fever, and headaches are the most common symptoms. But the symptoms you want to watch for going on to like getting worse are cough and shortness of breath, because those lead into respiratory issues. So a worsening cough and worsening shortness of breath are signs that it is getting worse. And those are all reasons to go to the ER. I would encourage you to go to the CDC site or listen to some of my previous lives, and we went over that. Now, when my boys called me and my friends called me, and they say, hey, they want a side consult. By the way, I don't officially give side consults, but when family members call and they want to go over symptoms just like real quick, and those are short conversations. The one that stands out to me when they start talking is, hey, loss of taste or loss of smell. First question I ask, when you've been sick in the past, has that ever happened to you? If the answer is yes, then it doesn't, I got to ask a few more questions. If it's never happened to you, loss of taste, loss of sensation, loss of taste and loss of smell is highly suggestive of COVID, of being COVID positive, if it has not happened to you in the past. If loss of taste, loss of sensation has not happened to you in the past, and all of a sudden it happens, it is suggestive of COVID. Hopefully that helps. Hey, what are your thoughts on attending weddings where they require masks be worn? It depends. So the official recommendation is it is not recommended. It's the official recommendation. In full disclosure, I'm gonna keep it real. I had one of my boys had a family member pass, and my boys, and I went and I wore a mask, but they follow all the guidelines and they promised us that they would. Massive church. It's only like 25 people in there. We were 20 feet apart, and then for the after part, it was outdoor, and people had to wear masks. I felt very, very comfortable, but officially I should not have gone. So it just depends. But what I would encourage you is, if you just decide to go to that wedding, you need to talk to the groom or the bride and just say, look, seriously, are people going to wear their masks? Because as you see, weddings and funerals, those have been hot spots. A vast deadman. Right, what does that mean? And what are your thoughts on going to the gym? I still don't recommend gyms. I don't go. In fairness, though, I got a home gym. If I didn't have a home gym, would I go? Probably not. But I've noticed that one of our gyms closest to me, and I live in like Bowie, Maryland, they moved the equipment outside. They moved part of it outside. I would go to that. If I were to go to the gym, I would be the first one there in the morning, or I would go very, very late when no one was there. And I would wear gloves and wear my mask. And I wouldn't do any cardiovascular at that gym because you're breathing out. You can do that outside. All right. And I'm about to sign out here. Hey, thank you all. Hey, please be sure to share this. Thank you all. I'm glad that I'm back. Hey, and also, if you get COVID, don't forget, most of us are going to be just fine. I've attached a little toolkit. Hit that. I heard there were some typos. I had a graphic guy do that. He went back and fixed them. Hit that. It's your COVID kit. In full disclosure, I'm trying to get your email address. Let me tell you why. Because what I've learned about social media, as we've all learned, if they hack you or if Facebook shuts you down because you were hacked, you have no way of continuing with your audience unless you have their email address. For those people whose email address I had, we were able to keep it rocking. Like I may not have been on social media, I may not have been on Facebook, but I was still increasing my YouTube, LinkedIn, and communicating with the rest of the audience through email. So the way it happens is if I'm shut down again and I have your email address, you send an email, we move it to Zoom, and we keep it moving. All right, so that's what I'm trying to do. And that is it. Hey, everybody, I'm gonna thanks for all the resources. Hey, good. Hey, you're welcome, Miss Ford. I do appreciate that. But again, encourage somebody. I will see you all soon for the part 4. For the part 4, and then maybe we will start to review the signs and symptoms again. The signs and symptoms, and then listen to how I say this, and I'm done. Listen to how I say this. If you have gotten a flu shot in the past, I highly recommend you getting a flu shot this year. If you've gotten in the past, I highly recommend you getting a flu shot this year and getting it very soon. And talk to your mamas, your daddies, and those over the age of 65. Have them get theirs even sooner. Why? Because they take a different one. The one that they take, it has 4 different strains of the flu in it. The ones that under 65 take, it has 3 different strains. The 4 different strains, it gives them greater immunity, a more robust immune response. For those over the age of 65, the nasal spray one does not work. It's only in the shot form. But what they're showing is that nationally, there is a shortage. Shortage doesn't mean that a shortage just simply means that in your area, they may go through a period of time where they may not have it. I understand that the pharma are increasing them, but it may take them a moment to like catch up. And once you get the shot, keep in mind, it takes about 2 weeks for you to develop an immunity. And one last point about the flu shot. People say, oh, when I get the flu shot, I get the flu. No, you don't. You have a reaction, a known reaction. You may have body aches, you may have a little fever, slight headache. That's a known reaction. You don't have the flu. That's just a reaction. And a day or two of that, it usually goes away in less than like 3 days. It's much better than a full 2 or 3 weeks of the full flu. So if you've had a flu shot, if you have had a flu shot in the past, listen to how I say that. I recommend you go ahead and get a flu shot. I'm about to get up out here. You're welcome, Jonathan. Hey, Kim, you are welcome. And be safe out there and do something kind and something nice for someone out there. Talk to you soon.